Assalamu alaikum, good evening, and welcome to the fourth Infants Nutrition Series webinars. The theme for this educational webinar will be Nutrition and Immunity Education in Saudi Arabia. This webinar is offered by Sasbigan and is supported by Nutrition Specialized Nutrition. This webinar has been accredited as 3 CME points by the Saudi Commission for Health Specialists in Saudi. Since this is a CME accredited event and as per the accrediting organization requirement, please note that credit certificates will be provided only to those who participated fully in the activity and complete its requirements. Let's start with this evening program. This webinar will take the format of 2 individual presentations delivered by our guest speakers and will be followed by a dedicated question and answer session. You have a chat tab that you can use, but please submit your question using the question tab that you can see on the right of your screen. Please, also we will have a post of poll the question, so please reply to theme in the poll tab to the best of your knowledge. To start the webinar, we would like to welcome our first speaker for this evening, Dr. Dhafer Alshehri, for his presentation on basics of toddler nutrition. Dr. Dhafer is Assistant Professor of Pediatric Gastroenterology Consultant. He is the Head of Pediatric Department at College of Medicine, Nagran University. Without further ado, let's welcome Dr. Dhafer to join us. Dr. Dhafer, up to you.
بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله. Thank you, Mr. Chairman. بداية أشكر صراحة الجمعية السعودية لأمراض الجهاز الهضمي والكبد والتغذية لدى الأطفال على هذه الدعوة الكريمة، وأخص بالشكر رئيس اللجنة العلمية في الجمعية الدكتور علي المهيدب على دعمه المتواصل. كما يعني خص كذلك بالشكر لرئيس الجمعية السعودية لأمراض الجهاز الهضمي للأطفال الدكتور معاذ التريكي على الدعم. كذلك أشكر الشركة الراعية لهذا الويبينار. بسم الله الرحمن الرحيم. Thank you, Mr. Chairman. كما أشكر كذلك شركة نوتريشيا على هذا الدعم المتواصل. Today I'll talk about the basics of toddler nutrition. It's the fourth webinar of infants nutritional webinars that has been started this month, and this is the last one. Hopefully you will enjoy it. There is a saying that tells that what you do, eat, and experience during the first 1,000th day of life makes difference for the rest of your life. A strong start is what you need for the success. A strong start is what you need for the good finish. And you know that the same in life, the first 1,000 days of life, from conception to 2 years, are absolutely fundamental for the development of the child, for the child health, and for the child well-being, and even the child's future. The first 1,000 days of life lay down the architecture of the brain. The first 1,000 days of life are the period of growth and development and the window of opportunity that makes all the difference to that child. So what do you mean by the first 1,000 days of life? As we mentioned before, that it starts from the conception, which from the start till the 9 months of age, till the first year of age, till the second year of age. This period account for 1,000 days. Why the early years are so important? You can see this paragraph, and you can see this window of opportunity. Before the child go the 4th year of life, you can see that all aspects of brain development are peaking in this period. And in fact, many cases in the first year of life, you might have already known that hearing, vision develop very early in child, in the first year of life. The same true regarding the language, which developed before the child goes even to the school. Also the social skills, language, it will all develop in this period. So it's very important. Although baby is born with all its brain cells and hundreds of billions of them, the connection between those neurons are established in the first years of life, and those connections come from the stimulating and caring environment. So if the brain is not fed and not stimulated in those very early days of life and years of life, we are depriving the child of health developing in the newborn brain. So it's very crucial. And as they mentioned, this is really window of opportunity. My concentrate on my talk tonight, mainly I'll concentrate on the toddler age, from the first year, second year of life, from 12 months till 24 months. So before we start, we need to know the terminology for non-physician attendee. What do you mean by infants? Infants, those children aging less than 12 months. The young children or toddler aging from 1 to 3 years of age. So the normal growth and development, actually it varies between infants, toddlers, and preschoolers. In the infants, they are actually triple birth weight by 12 months of age, but growth slows after that. And toddlers, they gain almost quarter of kg per month, and they will grow total of 5 inches in height. Preschoolers, they gain almost 3 kg per year. So the decrease in growth rate accompanied by the decrease in appetite and food intake. So why this period from the infancy to the preschooler age is important? Due to rapid development. They need high requirement for certain nutrients that actually not met by food normally eaten. So we need well-balanced diet in this period. So when we talk about growth and development of toddler, we should concentrate in main 4 areas of development: physical, cognitive, emotional, and social. We'll take each other in particular. What do you mean by physical development? The physical development, actually, it consists of 2 main things: gross motor and fine motor. And you can see here in this paragraph, the growth rate is very maximum in the first 3 years of life. But the maximum rate growth happened during the first year, and decline in the second year and third years of life, but still comparing to the normal growth rates during the childhood and adult, it accounts for the most. So as you can see, there is the child, it can pass various stages simultaneously and may sometimes skip some motor development. For example, it can, but overall, the child can, for example, he can sit unsupported by 9 months of age. He can stand at the age of 1 year, and he can also work on the furniture. And he can also ride a tricycle by 3 years of age. Regarding fine motor development, the fine motor is very crucial, especially for the children nutrition, because the skills, if developed well, the child gets higher chance to eat well. So we'll concentrate mainly on the child or the toddler can gradually start independently eat by spoon from 1 to 2 years of age, and can handle the fork and spoon confidently up to 3 years of age. The second part of the development is cognition or cognitive function. The cognitive function developed already occurs during the infancy and early years of life. Children process their impressions and ideas during plays in particular, helping them gain new insights. The emotional development also important in zone number 3, because a young children emotional life is already highly variable actually, and it lay importance not only in the cognitive and physical competence, but also emotional competence. For example, 1-year child can sometimes calm him or herself. The last domain of development is social. The child needs to learn how to form relationship and also need to learn and practice together. For example, here, 15 months child can initiate contacts with other children and he can play with them. So the growth and its measurement help monitor, it's very important to monitor child's health and development and reassure the child is growing normally or not. So we can identify the child if he's growing normal, is getting enough tall or enough height, and also if he become overweight or underweight. So the majority of overweight and obese child is caused by actually imbalance between what he take and what he expend. Obese children have weight that is too greater compared to their height. The excess weight is stored as fat, which affect their health during the toddlerhood and also in future of life. When we talk about nutrition during toddlerhood, we are not concentrating only on the quantity, but also on the quality. So the quality, it has very importance like also quantity. There is a saying that the children, they are small adults. Actually, it's not. The adult needs more nutrients per day comparing to the young children, as they are bigger and heavier. But the children need 5 to 7 times more certain nutrients than adults, actually comparing to their expressed relative to their body weights. For example, here calcium, the children need more than 3 times of calcium compared to the adults. Also choline more than twice, vitamin A, iodine, and etc. So let us take this ball and make you more interactive. According to the recommendations, what do you think? How many meals of the toddler should take? Can you please show the balls, Ustad Sahir? Mumtaz. 3, 4, 5, or 6 meals. What do you think? You have 20 seconds to answer this question. Okay. Can you end the ball, please? Okay. Excellent. If you around 38%, as you can see here in the screen, they choose between 5 meals or 6 meals. The correct answer is 5 meals. So what do you mean by 5 meals? The Research Institute of Child Nutrition, they recommend 5 meals, 3 main meals in the morning, in the midday, and in the evening, plus 2 snacks in between. So what are the nutrient requirements? The toddlers need wide variety of whole foods. As you can see here, the 5 food groups, which consist of grains, vegetables, fruits, proteins, and dairy. They need all these food, but in a different percentage. So very important what the child eats each week rather than what per day. So also we can concentrate on the energy needs. Actually, the energy needed in the toddlerhood, it's vary according to the mood or the type of activity. A child with sedentary life is different from the hyperactive child. But in general, it ranges from 1100 kilocalories per day up to 1600 kilocalories per day. The calories intake should consist or comes from different resources. For example, the calories taken from the carbohydrate should be from 40 to 60% of total calories. Comparing to the fat, around 30 to 50 of total calories. and the protein from 8 to 10% total calories. So we'll start by the protein. The protein, as you know, is vital nutrient. There is no life without protein. And actually, it helps in so many functions of the body. It builds up the muscles of the child. It can help also and transport the nutrients in the blood. It plays a major role in the enzymes and hormones production, and also in immunity as well. So what are the amount of protein needed in the child? Actually, it's estimated to be 1.1 gram per kg per day with a total of 13 gram per day. But take in considerations what we call it early protein hypothesis. There is a study conducted by Gunther et al. Regarding the early proteins and effects on the obesity later in life. This study concludes that the higher animal protein, not vegetables proteins, especially dairy protein intake in the first 12 months may be associated with unfavorable body compositions by age of 7 years. What's the mechanism of that? Because high protein intake, it can increase the insulin production in addition to insulin-like growth factor, which eventually lead to higher number of fat cells and leading to risk of overweight and obesity. So as you can see here in this graph, the protein intake according to European countries compared to the average requirements. As you can see here, the purple lines or purple zone, most of the children or toddlers during in the European countries, they talk the good amount of proteins and sometimes maybe higher than the upper limit of the requirement of protein. So we'll talk now about the fat. The fat actually consists of two main things, the good fat and bad fat. The good fat, which is mainly polyunsaturated fatty acids, which mainly omegas, which consist of omega-3, 6, 9, and 9. The difference between these omegas mainly due to chemical compositions. If you concentrate on the omega-3, it has actually so many types, but we'll concentrate in three main types, which is essential fatty acids, alpha-linoleic acid, and also EPA and DHA essential fatty acids. What's the importance of omega-3 and omega-6? Actually, it's important for brain and visual development. The brain development, in the first year of life, the omega-3 play a role in that. Also, retinal development, and also these fatty acids affect the mood and behavior. And the daily recommended allowance for these two essential fatty acids, as you can see here, omega-3, the daily allowance is 0.7 gram per day. Regarding the omega-6, around 7 gram per day. Regarding DHA, is one of the most important omega-3 fatty acids. And actually, it's linked in so many healthy benefits. And actually, it cannot be produced by the body. And it cannot be, so you should take and obtain a lot of diets, especially sources from seafoods and like fish and shellfish. And you can see here the DHA comprises over 90% of omega-3 in the brain and up to 25% of total fat content. So it's very huge. What's the importance of the DHA regarding the immunity? Actually, it plays a major role. And there is a study conducted by Perch et al. In 2010. They took two groups of children aged between 1 and 3 years of age. And one group, they supplemented with DHA supplemented formulas. The other group, the control group, with regular formulas. They concluded that the patient with the experimental DHA, they found that there is reduced respiratory infections and also fewer allergic disease and less wheezing and asthma. Also, there is a meta-analysis conducted and also it contains around 34 studies and huge sample numbers. They conclude that polyunsaturated fatty acid supplement may significantly improve cognitive development in infants, but not cognitive performance in children, adult, or elderly. The other bad fat, we call it saturated and trans fat. It should be actually limited, and it mainly comes from the animal sources, like red meat. And you know, the healthier fats are also naturally present in olives, and the trans fat should be limited to avoid complications later on in life. Now we'll talk about carbohydrate need. Carbohydrate need for the toddlers, actually it increased by 55% at 2 years of age, mostly to support the increase in activity during this time. The sources of healthy carbohydrates can come from grains, vegetables, and fruits. Now, the main things also for toddler nutrition is micronutrients. What do you mean by micronutrients? Actually, we mean by that by minerals and vitamins and trace elements. The main things for micronutrients or that comes with deficiency mostly is vitamin D, iron, and calcium as well. In the vitamin D, it plays an important role in development of bones and also in immunity and autoimmunity, and also can protect from future diabetes. And actually, unfortunately, approximately 90% of vitamin D is not taken up to our food, and it can be produced only by exposing to the skin to be transferred to active form. And you can see here in the paragraph the European countries intake, children intake, comparing to the recommendations. As you can see here, most of them, they didn't reach the lower limit of recommended intake. Also, vitamin D deficiency, it plays an important role during childhood and even in utero. It can, if the mother deficient in vitamin D, it can cause growth restrictions. If he born, and he will develop skeletal abnormalities, and also there is a risk of associated chronic disease later in life. Let's talk in number. As you can see here, these scary numbers. 75% of world population is estimated to be vitamin D deficient, huge number. And 36 million of women estimated to be affected with osteoporosis worldwide. From the toddler or children, around 1.1 million children go blind or die early from vitamin A deficiency. As you know, the vitamin A plays a major role in individual function. And about 600,000 stillbirth due to iron deficiency. And also 18 million babies born mentally impaired due to iodine deficiency. Recommended the steps for vitamin D intake is to have protected exposure to sunlight. And we should also take physical or encourage our children to have physical exercise at least 1 hour per day outdoors. And also increase vitamin D intake with supplement. There is and take care of the children with the high risk for the vitamin D deficiency, like vegetarian, those who take vegetarian diet, or those with the black skin color, and also with limited sun exposure or chronically ill children. The American Academy of Pediatric recommendations of vitamin D supplementations is vary between the infants, which require around 400 international units of vitamin D per day. Every 1 drop of vitamin D consists of 100 international units. Comparing to older children and adolescents, they required around 600 international units per day. As we mentioned before, the toddlers have increased nutritional requirements comparing to adults. From point of energy, they need around 3 times more comparing to adults of energy, more than 4 times compared to adults from iron, and more than 3 times from zinc and calcium comparing to adults. Also, the deficiency of the iron during prenatal health. Iron in the pregnancy given to the pregnant women, it ensures healthy deliveries and improves weight of the babies. Folate also help prevent neural tube defects in babies. So you should instruct the mother, pregnant mother, to take, especially in the first trimester. The infant and toddlers' optimal development, it will of vitamin D and iron, it will fight off the disease because strengthen the immunity, and also it will lower the risk of the chronic disease. Micronutrient deficiency impact on children. Worldwide, as we mentioned before, there is 160 million of children are stunted due to nutritional or micronutritional deficiency, and most of them from the developing countries. And they will not actually, comparing to their height or their body weight, also they will not achieve the good cognitive potentials. They will be bad in school. Regarding hydration is very important. Toddlers need to drink a lot of waters, which is the cheapest and healthiest drink. And it has to protect the children from the unhealthy drinks like soft drinks and so on. And also we should concentrate, especially in the toddlers, to drink from the cup, not from the bottles. Also, there is some foods should avoid during toddlerhood. For example, salt. The children or toddler have they shouldn't take no more than 2 grams of salt per day. Also, they shouldn't take raw eggs because the risk of salmonella poisoning. Also, the children or toddler, they shouldn't take nuts or chopped nuts because risk of choking. Also, sugar or added sugar because of dental problems and also risk of obesity. What do you mean by added sugar? The sugar that, for example, like brown sugar or sweetener, but the sugar included in the fruits is not added sugar. There is some, we can talk about the difficulty in feeding in the toddlerhood. Actually, the toddlers can often be challenged with several factors because several development changes are happening at this time. And also toddlers are striving for independence and control. They want to be independent. Also, their growth rate slows down, and with this comes decrease in appetite. So this changes can make mealtime difficult, actually, and we should instruct the parents to provide structure and set limits for the toddlers. How can we manage mealtimes difficulty? Okay, first of all, we should avoid battles during round table during the mealtime. Also, the mealtime should consist all the family members. Also, you should also we should instruct the families to be flexible because the children, they have acceptance. They are reluctant to try new food. We should also limit juice intake and encourage whole fruits instead. Also, there is some difficulty choking. How to prevent choking of the children? We should slowly adding more difficult to chew foods in their diet menu. We should also avoid foods that are hard, like nuts or also, and we can make it delayed a little bit, or for example, we can modify the risk food like grapes. We can cut it to quarters and feed the child. Also, the most important thing, we should supervise or instruct the parents to supervise the children during mealtime. And they should be seated, not laying down. Also, there is some healthy eating basics. Don't be alarmed if the child does not always meet the ideal. Every parent comes to you, they want their children to take the whole dish, okay? But we should insist on quantity, and actually the children to resist to eat certain foods. And they call it picky eaters. We'll talk it in a while. They are choosing some certain food and avoiding and refusing others. So the key point here to keep offering the good food to the child and new food many times. Remember that also the appetite of toddler decrease comparing to the children or the adult, because they are dealing at their specific time because of teething, growth spurt, and also another developmental milestones. Now we'll talk about picky eaters. Picky eaters, as we mentioned before, that means they are eating just small, single or two types of food and refusing others. And the picky eaters usually, maybe it's considered normal in the toddlers because of after rapid growth of infancy, when babies usually triple their weight, the appetite will decrease. And actually this age, the toddlers can develop food preference. They are familiar with some food and they didn't like others. And so we should instruct the family to not get frustrated and to be patient on toddler behaviors. So the key the key points here to instruct the family to try again. Please, just because the child refuses to feed food once, don't give up. And you should keep offering new foods and to those children didn't like before, up to 10 times, even till the taste bud accept it. And you should also instruct the family to relax. Please also don't pressurize them, don't enforce them to feed, don't punish the children, don't emotionally blackmail them and be calm. Now we'll talk about physical activities of the children. Actually, the sedentary life is not good for the adult as well as the children. So the recommendations for the toddlers to be active at least 3 hours daily. The American Heart Association recommends their eating patterns for families that they should delay introducing 100% juice until age 6 months, and limit to no more than 4 ounces per day. Juice should only be fed from a cup. Also, don't, because we so many patients also in the clinic, the family, they are overfeeding the infants and young children. Also, children should not be forced, as we mentioned before, to finish their meals. And we should also introduce healthy food and keep offering if they are not initially refused. Please don't introduce foods without overall nutritional value, simply to provide calories. Also, the energy calories should be adequate to support growth and development to reach a desirable body weight, not more than that. And please avoid saturated fat and trans fat and added sugar, as we mentioned before. And there is some reference you can take it, and it's helpful, like this one, dietary recommendations for children and adolescents, a guide for practitioner, and also this articles about nutrition in toddlers. And the conclusion, take-home message: toddler and young children has effects on physical and cognitive growth at childhood, and even adult outcome. And keep in mind, the first 1,000 days of life nutrition is crucial for healthy children. Thank you so much.
Thank you, Dr. Dhafer, for this great presentation. And please join us back for the Q&A session at the end of the presentations. Now, please help me in welcoming Dr. Rafat Mosali for his presentation on role of prebiotics in infant and toddler nutrition. Dr. Rafat is Associate Professor of Pediatrics, Medical College Umm Al-Qura University. He is the head of neonatal and pediatric ICU at International Medical Center. He's American Board of Pediatric, Canadian Board of Pediatric, and he's a fellowship in pediatric and neonatal ICU at McMaster and Ottawa University. Fellow of Royal College of Physician and Surgeon of Canada. His graduated degree in medical quality management by American College of Executive Board, and he is also a SAPI supervisor. He has a lot of application with research interest in nutrition, respiratory, cardiovascular disease of newborn, and pediatric. It's our pleasure to welcome Dr. Rafat to join us this evening. Dr. Rafat, up to you.
اوكي السلام عليكم. الحمد لله رب العالمين والصلاه والسلام على اشرف المرسلين سيدنا محمد وعلى اله وصحبه اجمعين. Thanks Dr. Sahir, thanks Dr. Dhafer. I would like to thank the Saudi Pediatric Gastroenterology Society and Nutritia for hosting this indeed important event. So my second half of the topic for tonight presentation is going to talk about the role of the prebiotics in infant and toddlers nutrition. So the three parts of my presentation would basically summarize the role of the breast milk for the baby's immunity. And then the second part of the presentation is to show the audience how we can, in an evidence way, and also in a theory way, how to recreate the immune benefits of the breast milk with prebiotics. And at the end, I'm gonna outline the future challenges and opportunities for using probiotics. Breast milk is widely regarded as the gold standard for infant feedings. Everybody knows this, and this is being endorsed by many societies. In Saudi Arabia, 80% of the infants, however, and this is shown by many studies, unfortunately, they are at some time on the infant formula. One goal of the infant formula manufacturer is to offer products that can simulate the composition and biological effect of human milk closely as possible. So we know that one of the immune function of the breast milk is to provide immunity. And I'm not going to talk about what is the specific and the detailed role, because everybody know what is the role of the microbiota and the effect of the breast milk in terms of increasing the diversity, increasing the activity, and also increasing the quantity of the microbiota or the healthy microbiota, namely biofid bacteria or biofid bacteria effect. So this graph, obviously, and I'm going to show you that at the end as well, in the clinical studies, showed you what is the difference between the breastfeeding infant and the formula feeding infant. I'm talking about the standard formula feeding infants in terms of the stool quantity. And this is just an intro for our presentation today. So as you can see, the healthy bacteria, Bifidobacter, is quite high in the breastfeeding infant in comparison to the formula feed infants. So this is well known, and it is multiplied and also replicated, in many studies. And the clinical effect of the probiotics is well established as a immune and also for the general health benefits. So let me start the presentation with an MCQ. I know it's already now 10:30. So just to keep everybody awake. So I ask the moderator to put the first poll, which is how we can change our microbiota to positively impact our health and immunity. So we'll give 30 seconds in order for the audience to get the right response. So perfect. So 50% has answered by consuming prebiotics and also fermented food. Well, you got it right, actually, for the one who with the 50%. History-wise, for many years, the scientists, for the last 20 or 30 years, perhaps, they know the effect on what is the microbiota exert in terms of beneficial health and immunity function. And also they come to know what is the factor such as a dietary substance that can enhance or inhibit the growth of such microbiota in the intestine. We call this as human milk oligosaccharides. If you notice in this busy slide, this is how complex is the breast milk in terms of the immune function it can provide. One of the most important immune modality that breast milk can provide is the oligosaccharides, and we call it prebiotics, but prebiotics is, oligosaccharide is just one component, one type of the prebiotics, which is the main interest of our discussion today. Interestingly, the things that, or the principle of fact that we should know that oligosaccharides is by far the third major component of the breast milk. If you don't want to calculate the water, it comes after the lactose and fat. So it composes between 20 and 12 grams per liter. And as you can see, it can protect against the attachment and of the invasive pathogens. Is going to show you in the few slides. So this pie chart also showed you that after the fat, after the protein, or perhaps similar, after the lactose and after the fat, the human milk oligosaccharides come as the third major component of the breast milk. So physiologically and clinically, it means it will enhance the microbiota, it will improve the gut health, and consequently, this will improve the immunity and the general health of infant, toddler, and also adult. As well as Dr. Dhafer said, whatever you eat is going to be reflected in the future. So it's an orchestra of function for the breast milk. And this slide, basically, it's a key slide. It's one of the first key slides of my presentation today. It shows you after the water, human milk oligosaccharides. It's not offering only immunity or the growth or gut health. It's offer everything, actually. And together with the other component of the breast milk, including the protein, lactose. What we care about here in today's presentation, because it's a half an hour, I'm not going to talk about prebiotics, it's going to talk forever. And we're going to focus mainly on the immune function of the human milk oligosaccharides. So as you can see, it's all immunity, growth, gut health. It's very a crucial part and well studied for the human milk oligosaccharides. So let me put you this slide, and I want you to guess which among all of the three animals do you think has a milk that is similar to the human milk in terms of oligosaccharides? Is it cow milk, which is the main component of the formula, goat, and there is some manufacturing companies that do the goat milk, or elephant? So which of those three animals are close to the human milk in terms of human milk oligosaccharides? So it's not an MCQ, but let me give you the quantity. Look at this, the cow milk, goat milk, and I have this MCQ before, and the audience has answered goat milk for some reason. I think because I think the goat milk company, they're doing a good job in terms of marketing, but don't be deceived by this. Look at this. Actually, the elephant is the most close animal. I'm not advocating for elephant milk, but just to show you, I mean, just a bit sarcastic in terms of showing you that human milk or the cow milk is far away in terms of similarity with the breast milk human-wise. So if in case you think as an adult, what is the other source for prebiotics, because you are not basically getting formula milk, well, as an adult, you can get that prebiotics in different food and different vegetables And this is one of the 10 or the one or two few food items that contain high amount of the prebiotics. But let me tell you, unfortunately, this standards, the composition is not enough, and that's why the manufacturer now are producing the oligosaccharides in a special format. We call it FOS and GOS, and in order to have that clinical beneficial effect that you would anticipate or you would hope to get as an adult, in case if you want to introduce it later on. So in the second part of the presentation today, I'm going to talk about the physiology and also the theory behind how we can recreate such immune benefits of the oligosaccharides and to make it somewhat similar to the breast milk. Before that, I just want to introduce the definition of the prebiotics, and I want you to go through historical lines, a timeline. It's quite interesting that the first definition, the generic or practical or clinical, whatever you want to call it, started or labeled 1995, so about 25, 30 years ago. And it was referred as non-digestible food ingredients that beneficially affect the host by selectively stimulating the growth of number of bacteria. And look at the progression. It took 9 years also to more clinically define the prebiotics to a selectively fermented ingredient that allow specific change in the composition activity of the gastrointestinal microflora. So, and the last definition by the ISAP, it's International Society for the Pre and Probiotics, they make it more practical and more clinical oriented in terms of putting it as a selectively fermented ingredient that result in specific changes. The European has also a different definition, which really I like. It's a substrate that's selectively utilized by the host microorganism, conferring health benefits, because the health benefits is not only conferred to the immune function, it exerts in many health benefits, including the bone, endocrine, general health, and even in the gut colon cancer. So I'm not going to talk about all that health benefits. As I promised you, I'm going to talk about the immune part, which is really important for our talk today in terms of the toddler nutrition, which is the theme of our talk today. So as you know, the microbiota in the baby bone has different factors that could, in fact, inhibit or has an impact on the growth, such as hospital environment, use of the antibiotic, cesarean delivery, and also if you give the standard formula milk, which doesn't have the prebiotics. So all of that will result in increased pathological bacteria and decrease healthy bacteria. It's not only for the neonate or at the time of the delivery. In fact, also for the mother in pregnancy, the things of the microbiota, the composition, the quantity, the diversity will start programmed from the time of the first, second, third trimester. Whatever the mother eat, whatever the mother have, use of antibiotics, and the method of delivery as well. The type of feeding, breast versus feeding standard formula, all of those factors will affect negatively and positively the gut microflora. And if we think as one of the strategy, of course, the prevention that would start early on from the time of the pregnancy and also on the maternal health, it will be an ideal, but also one of the strategy that you can implement as a pediatrician or a community health practitioner is to think about if the baby is not breastfeeding, then you have to think about the formula feed that has prebiotics inside it in a way that is close in terms of a biochemically structure and bioavailability, such as close to the human milk. So it is just one step closer to the gold standard breastfeeding formula. That is one of the, this is a strategy that you can promote. So this, when we talk about this, knowing the molecular size and the structure of the human milk oligosaccharide is very important for the companies that want to engineer a similar component, a similar composition, which is usually when you hear about GOSM, this is called galacto oligosaccharides and fructine by this. It's just the engineering of it. We want to make it closer to the human milk. So all the clinical studies, in fact, as you can see in this table, has done tremendous researches in this sort of combo or mixing, which is the GOSM FOS in terms of 9 and 1. So I just want to show you that there is many oligosaccharides, but the major part or the major type of the oligosaccharides is GOSM FOS. By far is the most studies that will done, and it shows beneficial benefits. Before I go to the third or the evidence base, I just want to give you just also another challenging MCQ. And I want to, perhaps you heard about this terminology, but I just want to make it entertainment for you. What is symbiotics? I'm sure that you heard about this, but let us hold the second question, please, the moderator. Can I get the answer, please? Thank you. You got it right. 2/3 of you, they got it right. So it's a product that contains probiotics and prebiotics. So prebiotics, probiotic. What about also symbiotics? We already answered this. Is a combo between pro and pre. There is something called postbiotics. And again, this is something, it's a hot topic. It's a non-viable bacteria. It's also by result of the engineering, a metabolic byproduct that also has been studied, and it has a lot of beneficial effect that I'm not going to talk about. And in the next few minutes, I'm gonna just go. I promise you, I'm not gonna bombard you with a lot of evidence and the study and the statistic. But I just want to have a glimpse about how prebiotics has an immune modulation role in terms of evidence. This is, I promise you, this is the last MCQ. Prebiotics role in immune modulation is exerted by, again, the poll, please, and that will be the last poll for tonight. There you go. Perfect. So the majority of you has answered correct. Let me tell you just a secret. In any webinar, if you have all of the above, usually the presenter wants all of the above. Okay. So before we go to the clinical evidence, let me show you this key slide. And this is my second key slide for tonight's presentation to show you. And let me tell you, if you get that slide, this will suffice me in terms of understanding how prebiotics exert an immune and protective function by microbiota and also by modulating the epithelial tissue and also the adherence of the microorganism to the tissue. So as you can see in the first pizza slide or pizza-like slide here, this is the human milk oligosaccharides or the oligosaccharides, the prebiotics. It will enhance the growth of the microbiota because it is the food. Without the food, how on earth the microbiota or the healthy microbiota would survive or will cultivate? The same thing would inhibit the growth of the pathogenic bacteria. In the second piece of this slide, it also will act as a decoy. Decoy means something fake in terms of for the pathological bacteria, virus, parasitic, whatever the pathogen, to prevent the adherence or the adhesion of this virus or the bacteria into the epithelial tissue, and hence will prevent the permeability and also the leak. The same thing also, it will modulate the protein in the epithelial cell receptor of the gut in a way that it will enhance the tight junction protein of the epithelial tissue at the level of the gut mucosa, so that means it will enhance tight junction, decrease the permeability, and decrease the gut translocation. So collectively, if you think, it will result not only in the inhibition of the bad bacteria and the increasing the good bacteria by being a fuel for it, it will also modulate the epithelial junction and decrease the pathological bacteria to translocate into the system. So was that clinically proven? The short answer is yes. However, the data is not that strong, but at least it is encouraging. And the data also showed that the babies or the infant that use the formula that contain the human milk oligosaccharides has tolerated very well without side effect. So at least this is the first part of the hope and promising effect. So this is again the slide that showed the formula-fed infant has a stool, and if it's not supplemented, that is contain less amount of the healthy bacteria, bifidobacteria, and contain a lot of E. coli and bacteroids if not fed with the human milk oligosaccharides formula, supplemented formula. So the evidence in summary showed that increased fecal level of bifidobacteria and lactobacillus, and that level extend up to 2 years, and for the baby who fed a formula up to 3 or up to 6 months of life. So many randomized clinical double-blinded studies has shown this effect. I'm just going to go through quickly because, as I promised you, for you it's an eye-opening, and I'm happy to share with everybody. Need to know the references at the end. Basically, what I'm going to show you that the fecal matter for the baby who fed with the Foss-Gauss formula has a significant value of the bifidus bacteria if you compare it to control one who doesn't have that Foss-Gauss prebiotics. So look at this, and also for the same thing with a significant value. So again, this is another study that showed in comparison to the control one, the bifidobacteria by far is, and even it is a dose dependent, and the dose also lasts at the age of 3 and 6 months for the baby who fed that specific formula. The second part is actually it decreased the quantity of the pathological microorganisms such as E. coli and Clostridia, specifically that can cause, as you know, gastroenteritis. And for the formula baby who and control in comparison to the Foss-Gauss formula, you can see, though it is not that huge numbers, but at least the evidence is promising. So when they studied the stool, they showed that pathogens is clearly decreased in terms of Gauss and Foss formula in comparison to the standard formula. What about the other secretory IgA production? Again, the data here, unfortunately, is not consistent, but at least it's promising. I mean, not consistent in terms of it did not show a decrease. In fact, it showed increase or similar between the control and between the Foss-Gauss formula. But look at this, in terms of close to breast milk, it has a comparable measures for the IgA. Again, and this is, I'm not going to show every studies. I'm just going to be quite brief and focused. I just want you to correlate between each immune modulation and the clinical effect, and whether the prebiotics has a correlation with that or no. This is a study that showed lysozymes, which is one of the immune modalities, and it is also, if you compare it to the breastfeeding, it is less, but if you compare it to the standard formula, it is a bit higher with a significant p-value, and that is continue after 2 months of age. In terms of reduction of the infection, and again, if you want to talk about anybody who want to talk about prebiotics, he will mention the Milan study, which is done in 2006, because by far this is one of the most largest study. In fact, it shows you that the infection in terms of comparison between the Foss-Gauss formula and the control, it will decrease, as I'm going to show you it. And the type of the infection, respiratory tract infection, gastroenteritis, and also the infant who required antibiotic therapy, as this slide show. So all of those significant comparison. So this is again overall infection, upper respiratory tract infection, GI infection. It's repeatedly shown by many studies, and also by the Arzolongo 2007, and also in terms of decreasing the incidence of atopic dermatitis. And that by itself is another talk. It might require another half an hour, which I'm not going to talk about, but it is very important if you also started in an infant who are at high risk of allergy. So just to continue, the same thing for the decrease in the antibiotic use, and this is a 12-month open study in 2009, decrease the infection in the infant and the upper respiratory tract infection, and also more than 3 upper respiratory tract infection. This is a combo slide that shows you that any infection, recurrent infection, or recurrent upper respiratory tract infection has a significantly decrease in infant fed with Gauss and Foss formula. So this 2 years follow-up study showed the same thing. It's not only about the type of the infection in general, but also the infection that needs antibiotics, and the parents diagnosed fever. It's quite significantly lower in an infant who fed with the Foss and Gauss formula. So that beneficial or immune protection effect actually lasts not only for a few months or at the time of the formula feeding. It lasts up to 18 months, and in few studies it lasts up to 2 years. Unfortunately, because of the limitation, you're not going to find a study that will be a long-term beneficial. But I'm going to show you what is the future implication in the last third part of my presentation. So this is like a meta-analysis, and it will summarize for you so far till 2009 or 2013, in fact, until the time of the meta-analysis, that at least you know, this is a pooled analysis, at least the infection that require antibiotics, the pooled analysis or the estimate point, it favor the baby who fed on Foss and Gauss formula in comparison to the control who wasn't fed. So at least the infection required antibiotics was decreased. The febrile episodes and diarrheal episodes, it is in the direction that favor, but it is not statistically significant. This is another by far large study as well, 2014. It shows you also the number of infections significantly decrease, and there is a trend toward reducing patient report of the infection. And this is by far was one of the big study that was also long period up to 52 weeks. So The prebiotic supplementation to the infant formula may reduce the risk of infection, mainly upper respiratory tract infection, and also may reduce the use of the antibiotics. This slide shows you again the summary of the FOS and GOS, and it shows you that there is many types of the oligosaccharides, but by far, as we said, the most important things is the FOS and GOS. And look at this. If you review prebiotics, you're going to see a lot of animal study. You're going to see a lot of a human study. And let me show you, this is not only on the newborn or infant, it's also up to the adult age, not only adult, also elderly and pregnant woman, as this presentation or at this table show you. So the prebiotics is not only in the first 1 or 2 years of life, it's up to elderly, and there is a potential for the adult as well. So in the premature infant, because this is my background as a neonatology, I feel urged that I want to tell you the evidence is encouraging, however, is not statistically significant. What so far we have as an evidence is the growth of the bacteria in the babies who fed with the prebiotics formula was significantly reduced. However, that was not resulted in terms of clinical decrease in outcome, such as NIC, late onset sepsis, or mortality. So in summary, this is the human milk oligosaccharides. As we know, we have been through this in the first 2 parts of the presentation. It's definitely well tolerated, and the study showed that. Unfortunately, I did not show you the study, but this is the conclusion of it. Shows that it decreased the risk of upper and lower respiratory tract infection, and also significantly decreased the use of the antibiotics. I just want to conclude before I want to go to the take-home messages, or sorry, the future implication, is to stress on what Dr. Dhafer said in the first part of the presentation. Whatever you eat is going to result into better life or a better health in the adult life. And that the theory behind this, I want to stress on, is we call it metabolic imprinting. So the idea is what we eat today, it can impact our development tomorrow. It's not only in the toddler, it is in the teenage, adult, and elderly as well. And this is why prebiotics is one of the hot topics that is being discussed in each gastroenterology. Let me tell you, if you're a gastroenterologist, it's also in our neonatology presentation. We talk about this, and I'm sure also in the general pediatrics for sure. So the effect of early nutrition on the immunity is called immune imprinting. So this is the beauty of this immune modulation. Whatever it's going to eat, it has immune metabolic imprinting that will result in better health, better immunity, and a life being earned for the future. Probiotics are, I hope I showed you that the probiotics are now promising approach to develop immune fitness. As we have physical fitness or neurological mental fitness, we do have immune fitness in infancy. Good data with probiotics on the infant infection rate. We need larger study with long-term follow-ups. Study showed should have clear clinical outcomes with a good microbiota analysis. Human milk oligosaccharides currently require more human data with infection as a primary endpoint. The WHO, which is the World Allergy Organization guideline panel, suggests prebiotic supplementation and not exclusively breastfeed infant, both at high or at low risk for developing allergy, to decrease the risk of the atopic dermatitis. So in the take-home message, I hope I showed you that oligosaccharides are prominent in the human milk. It's not available in the standard formula, and it constitutes the large or the third largest component. There is different kind of human milk oligosaccharides directly or indirectly modulate the infant physiological system by regulating the microbial composition, preventing pathogen adhesion and invasion, and regulating the intestinal epithelial cell response and the translocation. The addition of certain mixture of the oligosaccharides in infant formula, however, can result in a better health beneficial effect for baby who cannot breast milk fed. The second take-home message for the clinical benefit, as I showed you, that there is a promising and good amount of evidence for human trials. I did not mention the bench studies that showing promising effect on the intestinal level of the biofidal bacteria that has a good association and improvement in the infant growth, and it provides indeed protection against different disease. It's not only infection, different disease which has a high morbidity and mortality for the child health. The last take-home message for what is the future implication and the future promises, human milk oligosaccharides not merely affect or has a beneficial effect on the infant, but also have an influence and play a special role in the prevention and treatment of the disease in children and adults. Therefore, further studies are needed to help to establish the correlation between what we know as a modulation effect of the prebiotics and the intestinal microbiota for prevention of single and or multiple combined disease. And with that, I would conclude my presentation, and I will leave the panel to pose the questions for me and Dr. Dhafer. Thank you.
Thank you so much, Dr. Rafat. Very nice presentation and demonstrations. We enjoyed it. It's informative, and I hope all of the attendees they can get most of it. The questions, there is a lot of questions. Actually, it was answered during your talk or my talk. Anyway, there is a hot questions coming up all the times. They said, what is growing up milk? Actually, the growing up milk formula, according to the nutritional need, as I mentioned in the toddler age, most of the children, they didn't meet their allowed requirement. And so they came up with this growing up milk. What is growing up milk? It's a formula that contains many components, like which is showed beneficial effect, as Dr. Rafat said, like long-chain polyunsaturated fatty acids, also GOS and FOS, which is galacto oligosaccharides and fructooligosaccharides in a golden ratio from 9 to 1. This ratio is very crucial to as a prebiotic to build up bifidobacteria and lactobacillus, which is good benefit on the gut microbiota. Also, it contains iron and vitamins, which supported, as we mentioned in my talk, the children, they have decrease or deficient, they are, the deficiency of vitamin D deficiency and iron deficiency is common during this child. So they support this formula with types of micronutrients. This is the growing up milk formulas. There is actually been studies, Dr. Rafat, he showed a lot of them. There is two actually giant studies and idea studies which support the effect, the positive effect of this formula comparing to the regular formula in terms of decrease infection and also in providing iron and vitamin D supplementations. This is regarding the difference between cow's milk also and growing up milk formula. There is a question also, Dr. Rafat, you actually came through it. One of the attendee asked, what is postbiotic?
Yeah, I posted for him this slide. I was expecting this question. I did this many times, so I leave it at the end. So there you go. Postbiotic is the beneficial metabolites of the prebiotics. Let me tell you that if you want to ask, I mean, this is a hot topic. This is just for the last 10 years. And now a lot of companies with the special engineer, they are doing this rather than to take the actual healthy bacteria, they want to engineer and to take that beneficial metabolites and to give it as a supplement for the baby, not necessarily only in the milk, but also as drops, such as the prebiotics drops. So this is to answer. And again, the study for the postbiotics are still preliminary. It is at the bench side. It is not, to my knowledge, studied in the neonates, and not, to my knowledge, also studied in human milk, or sorry, in the formula milk. So this is just to shortly answer your question.
Thank you so much. There is also questions, I think this for me. Can energy protein malnutrition can result in abnormal development of the brain? Yes, of course. All of the nutrients is important, micro and macronutrients. It can help, as we mentioned before, and Dr. also Rafat, he stressed on this sentence, the first 1,000 days it's determinant for your future. So really it affects the brain development for sure. Also, there is a question for you, Dr. Rafat. Did they say all the prebiotics are the same or different?
You know what, this is an interesting question, and this is very, very important question. And the short answer version of this, they are not the same. And there is more than 250 prebiotics, in fact. And that's why I showed you early in the lecture, the most important things are the GOSAMFOS, or they call it F2/prebiotics. This is by far what it is studies in the human data. And so the answer, yes, there is many types and many component of the prebiotics, not only in the quantity, but also in the mixture, in the engineering. What do we care about is the one that is close to human milk. And this is what has been studied not only in the neonate or peds, but also it was studied in the pregnant and also in the adult patients as well.
Thank you so much. There is a lot of asking from our colleague. They need PDF for the lecture. This lecture, it's recorded. Inshallah, we will upload it to our YouTube channel, SAS Began 2021. You can follow us on the Twitter official sites of SAS Began, and you will find the all interesting things uploaded to the YouTube channel, and as well as the Twitter account. I think there is no more questions. If you have last talk, Dr. Rafat, last message before we close up.
Last message is I would like to thank you, Dr. Dhafer, because you know what, this is the nutrition. They choose two challenging topics that could not be covered in half an hour for each. Toddler by itself is not challenging for us as a pediatrician, but also as a parents. So you cover it very well. And the prebiotics is another hot topic, an area of debate. And I'm so glad that my topics come with your topics in terms of a two combo of challenging. Again, my message is whatever your baby, or whether it's your baby as a parent or the baby that you are seeing as a pediatrician, gastroenterologist, neonatologist, etc., whatever you recommend, it has to be very clear from the day zero, newborn. In fact, even the obstetrician, they need to know this in order to make sure that our babies, the one that we take care, they have a better future, not only in the immune and the protection, but also in the overall health. Thank you.
Thank you so much, Dr. Rafat. I enjoy really your talk. Thank you for all attendees for their precious time. Thanks for the sponsoring company, and see you inshallah in future webinars with a lot of interesting things. Thank you so much.
Good night.